Over 42% of Americans in 2020 were obese, according to the Trust for America's Health study. So why are the rates of obesity so high today? Many experts today have correlated the rates of obesity with the lack of exercise and physical activity today. So we're going to be looking at how lack of exercise causes obesity and many other health problems. It increases the risk for heart disease, cancer, diabetes, and many not good things to your body. I am a nursing student and I have studied anatomy and physiology, and I have worked with patients who have many health problems that have been aggravated and worsened and caused by obesity and lack of exercises. So today I will be talking about running and how that improves the body's function in relating to lack of exercise and obesity, and how that it improves those functions, how it improves the heart, the lungs, the liver, and many other organs, and increases your brain and mental and emotional health. So first of all, let's look at the problem. The problem is the lack of exercise. What does the lack of exercise do? It increases your risk for obesity. CDC says it clearly is correlated with increased risk for obesity. Secondly, it increases your risk for heart disease. So let's take a little look at how lack of exercise is increasing your risk for heart disease. So with lack of exercise, your arteries in your heart and parts of your body can build plaque. And here's what this plaque looks like. It starts out small, and then it keeps growing and growing, and eventually it becomes so much that when blood goes through it, it clots a lot easier, and it can block off the artery and cause a heart attack, or if it's an artery in your brain, it can cause a stroke. So lack of exercise increases risk for heart disease, heart attack, many things like that. Also, it can increase your risk for many other diseases. CDC says lack of exercise increases your risk for type 2 diabetes, cancer, high blood pressure, and high cholesterol, and many other diseases. So let's look at how we can combat this problem by looking at running, cardiovascular, which is a cardiovascular sport, and how that increases your physical and mental health. First of all, it helps improve weight loss. So Mohammed Hassan and colleagues wrote an article, and it says that running improves glucose metabolism. So it improves how the body uses your glucose, and it increases insulin sensitivity. So it helps the pancreas and the body cells to become sensitive to insulin. It doesn't have to make so much, in which both of those factors help decrease weight loss. And we see that also with the decreased risk for diabetes, as Dr. Juliet McGrattan says, that running helps with insulin secretion in the pancreas, and thereby lowers your risk for getting diabetes mellitus 2 by 50%. Thirdly, running helps strengthen bones. Dr. Juliet McGrattan also says that running strengthens bones and can reduce your risk for osteoporosis. Running can help prevent osteoporosis and help treat osteoporosis, especially in postmenopausal women who have low levels of estrogen and are at increased risk for decreased bone density. Running helps strengthen the bones and increase the bone density and keep that mineralization and deposits of the nutrients in the bones. Fourthly, running improves brain health. Dr. David J. Linden says that the body releases endorphins which many people have associated with a runner's high, or what people think of runner's high. And this helps reduce levels of anxiety, and it can help alleviate stress and many things related to your emotional well-being. Those endorphins also help improve memory and focus. Long-term effects of running has seen to make you more sharp, improve your memory, and keep the risk factors for like Alzheimer's and dementia lower. Fifthly, it helps decrease the risk for heart disease. Muhammad Hassan and colleagues in his cardiology journal says that running decreases your heart disease by over 30%. It increases cardiac output and preserves ejection fraction, which in overall makes your heart more efficient. And it also strengthens your heart. Your heart is a muscle, and as you build it and use it, it becomes stronger. It also helps decrease the risk for many diseases. Dr. Juliet McGrattan says it helps treat joint diseases, osteoarthritis, lowers cholesterol, decreases IBS, reduces the risk for liver failure, decreases risk for breast cancer by 20%, and improves lung function and decreases risk for asthma. In conclusion, as we see the increased rates of obesity directly related to the lack of exercise, we can look at how to combat that by running, and how running increases and improves heart, lungs, many organs in your body, and decreases risk for many of those related diseases. So, do you want to decrease your risk for heart disease, cancer, obesity, and many, many other diseases? Run.